Right, so where are we? Episode 4. It's been a little bit of a while since I've made one of these entries, so bear with me. Just to fill you in, so I guess it's been about 3 or 4 weeks since I last did this, in which time I've had my first round of chemotherapy. I've had just under 3 weeks to recover from that, and now I'm back in the hospital having my second round of chemotherapy. That noise you can probably hear is the machine whirring away the 2 drips in my hand. So please bear with me on that. I thought it might be nice, well, interesting at least, to see what it's like, get a bit of an idea. I know that a lot of people have the treatment at home, so this, or as an outpatient, so this is not necessarily how everyone would have it, but this is me, and I'm in hospital having the chemotherapy, so here we go. The last treatment was not nice by any means, but it definitely wasn't as bad as it could have been, or as bad as I maybe feared it might be. The first day or so was all right. I didn't really feel it. The second day I started to feel a bit of nausea. By the third day I was really wiped out and feeling very ill, very down, and just totally wiped out. And I stayed that night as well, and the next day I felt pretty rough, but getting back on form. I think the next sort of 3-4 days, maybe 5 days, I was on anti-sickness drugs. I got home on the Tuesday and actually took the last lot of anti-sickness drugs on the Saturday. I was never actually sick, but that feeling of nausea does stay with you. It's quite noticeable. Eating well, actually, so it didn't necessarily stop me from eating, but eating well, eating like whole meal rice and nice home cooked food actually helped the nausea in a lot of cases. In a lot of cases I couldn't face eating anything. Some things I ate on the day that my chemo started, for example hummus, really has stuck with me, and the thought of some of those foods really makes me feel sick. But hopefully that'll wear off. I have actually eaten hummus since, so it's not actually the food, it's more the thought of the food that's a bit weird. Side effects wise from the first round, obviously the nausea, as I say, that wore off after 5 or 6 days. Came back a little bit towards the end, but I think that might have been down to kind of me feeling a bit anxious about starting again. Hearing, felt like I had blocked ears for the first few days. I was getting tinnitus at patches. I was losing some ranges of hearing at stages, but that all settled down a lot. Then I started to get itchy about a week or 10 days, maybe 2 weeks later. Itchy, just dry skin, rashes, so a lot of sort of E45 cream and bath emollients kind of helped that. And then probably about 2 weeks into it, my hair started coming out one day in the bath. So I shaved it all off, as you can see. It's been coming out at fairly steady rate since. You can't really notice it now because it's so short, but my beard hair, my head hair, other parts of the body, hair's starting to fall out. It's quite weird and a little bit distressing, but to be honest, the least of my worries, at least personally, because as you can see from the earlier videos, I didn't have much hair to start with, and I actually quite like the feeling of having no hair, so no real problems there. I spent the last week or 2 weeks feeling pretty okay, getting on with things at a pretty relaxed pace, not doing too much. I've been seeing an acupuncturist once a week, which is the other side of London, and that takes the best part of the day. I get driven there, usually by my mum, and driven back. So that takes up one day. Then another day I might pop out for a couple of hours. I've had lunch with work people once. I've cooked for people a couple of times. I'm pretty active, but like I say, no pressure on me to do anything, and just taking care of myself, really, eating very well, taking a lot of vitamins and like fish oil, just food supplements, wheatgrass, spirulina type stuff every day, juicing carrots and beetroots and all kind of stuff, just to make sure that I'm kind of eating as healthily and as I possibly can. I'm now in the hospital for round 2, as I've said. Leading up to it, I think, I felt a bit anxious about coming back in and going through it all again. Some people have told me it gets worse with every dose, so this could be worse, although my doctors tell me that their anti-sickness plan for me this time should be better, so that's good. I went for my second CT scan, actually. This is the good news. I went for my second CT scan a couple of days ago, just before this round of chemo started. Now, there's always a slight risk of chemotherapy not working as well as they hope it might do, depending on what chemotherapy you're having, what kind of cancer you've got. Obviously, you've got different, prognoses and different outlooks. Testicular cancer is a very good outlook, and 90% or around that, a little bit more or less, depending on what stage you're found at, are totally cured from their, first treatment of their first course of chemotherapy, and it doesn't come back. But there's always that chance and that worry that you fall into the very small category of people that it doesn't respond so well the first time, and puts you in that horrible kind of wondering what's going to happen and when it's all going to be okay kind of stage. So basically, I had a CT scan a couple of days ago, and that was to determine whether or not it had all worked. The chemotherapy was working, it was doing its job. So that was a very tense couple of days leading up to that. Although I wasn't dwelling on the negatives, I was very aware of the possibilities that all might not go as well as hoped, So anyway, I got the results that evening, and I'm very pleased to say that the lymph nodes that were there, that it was evidence of the cancer spreading, had gone, which basically means, hopefully, that the chemotherapy first round did its job. The swollen lymph nodes are gone, or they've gone back to normal, and I'm now having this round and the next round to hopefully ensure that it doesn't come back. So that's where I am now. I've got more side effects to look forward to now. Well, another 3 days of chemotherapy to look forward to now. This is just the start. All the side effects again, possibly worse. The rest of my hair falling out. My immune system's very low, I hear. So my neutrophil count, my white blood cell count, very low, which is a little bit worrying, but not unusual. So I have to stay away from people with colds and just generally try not to get ill, because I've got no immune system to fight it off, and that means coming back into hospital and being injected with various immune system boosting and white blood cell boosting and all kinds of stuff, antiviral drugs and antibacterial drugs. So hopefully it won't come to that. All I can say really is that I'm just really thankful that it hasn't been worse, and that my CT results were so good, and it looks like I'm going to be okay quite soon, which is just very reassuring. I'm still very positive about the whole thing. I'm still taking a lot from it, and I hope that these videos can kind of put somebody's mind at ease who might find themselves in the same position or a similar position. And there's my chemotherapy machine beeping for some reason. Anyway, thanks a lot for listening. Speak soon.